Is there something in the law in the rates regarding males and females?
That's right. One of the big complaints with the current insurance regime is that insurance companies have basically been able to discriminate against women on a couple of grounds, but the most notable one, of course, because women can bear children and have babies, they have built in higher insurance premiums for women, and sometimes premium increases that don't really seem to be very rational or related to the medical conditions that people have. And so what this legislation is going to do is try to equalize that and say you can't treat women in a discriminatory manner in terms of premium structure for insurance coverage.
So there are some big changes in
They're very big very big changes. And as I mentioned earlier, some of the insurance reforms, such as the ban on pre-existing conditions for children, those things kick in immediately, but fully take effect within 3 or 4 years.
You had mentioned earlier solvency of the Medicare Trust Fund. Is this improved Healthcare Reform Act going to break the bank? Is it going to be a wash? Or
actually, the Congressional Budget Office, and again, let's understand who CBO are. It's not Nancy Pelosi and the Democrats, and it's not Mitch McConnell and the Republicans. CBO is the nonpartisan budgetary watchdogs for the Congress. They look at bills and figure out what's the fiscal impact of this bill? How is it going to affect how much money the government's spending? Does it add to the deficit or does it reduce the deficit? And on the health care reform law, what CBO discovered was very interesting. They say that it actually is going to reduce federal budget deficits by about $140 billion in the first 10 years, and in the second 10 years, will reduce deficits by $1.3 trillion. And you say, well, how can you do that? Because you're suddenly going to be covering 33 million people that weren't covered before. When you start covering people and catching medical problems early rather than waiting later when they're much more expensive to treat, you're going to drive costs down. And we're paying a tremendous cost in our country right now for having about 47 million Americans with no insurance. We pay business pays a tremendous cost in terms of lost productivity, the economic drag, higher insurance premiums that the rest of us who do have insurance have to pay. And so CBO looked at the numbers, and I think that's pretty impressive because that's quite contrary to what many of the critics of this law said would happen.
Okay. Now let's look at a different age and the effect on the law. Let's go to the opposite. Well, not exactly the opposite, but close to it. Students.
Yep.
Possibly our grandchildren. There are two big changes in this law that affect students. Could you tell us about that?
Well, there's some really good news in here for young people. Many young people, when they leave home and they go off to school or go off to work, find that they no longer can afford insurance. Of course, when you're young and you're 25 or 26 years old, you think you're immortal. I remember that myself. But luckily, through my dad's insurance, he was able to carry me on his insurance up until I was about 25 years old. Under this new law, parents are going to be able to carry their children on their insurance policy up to age 26. That's a significant improvement because actually one of the fastest growing categories of people without insurance are people in that age group 18 to 26. And so this bill allows the parents to continue them on their policy.
And with college students taking more than 4 years to finish, that part of the population is covered. I remember our daughters were covered to age 22 or completion of college. And kids are graduating at 25 now.
That's right.
So that takes care of those people. What restrictions are there on health insurance companies in this bill?
Well, again, we talked about a few of them. The insurance reforms with the insurance companies, they're going to have to submit premium increases to a rate review process, which actually, I said earlier, it's federal. It's actually a joint federal and state review process that's going to be created here, and they're making rules on that right now. We don't have all the answers about how everything's going to work, but the basic structure that they're not just going to be able to pass on whatever rate increase they want to with no review. I think some of our listeners may be familiar with the case of Anthem in California recently, where they raised insurance
Yes.
premiums 39% in 1 year, far in excess of even the inflation rate in healthcare, which has been running about 3 times the regular inflation rate. We've had generally low inflation lately. It's been about 3%, but healthcare costs across the board have been rising at 9 to 10% a year. And here Anthem came along and tried to raise rates by 39%. So that type of thing is going to be subject to a review process by federal and state authorities to try to get some discipline into the rate structure.
Okay, what is required for a ordinary citizen under this Healthcare Reform Act?
The individual mandate
Yes.
is that folks who are able to, now there's an exception if you're an economic hardship case. If you can't afford it, there is an exception. But for the most part, most individuals are going to be required to purchase qualified coverage by the year 2014 and to maintain that coverage. And again, the rationale is unless we have broad coverage, then the folks who don't buy coverage but then need medical care, we're all paying an additional cost for that. In fact, I had seen a figure this year that the average American who is insured pays about $1,000 a year more for their insurance because of the 47 million people who are uninsured. And when they get sick, that uncompensated care, the cost of that care ultimately gets picked up by people who do have insurance.
Has the government placed mandates on people before?
Well, you know, this is an interesting part of this debate, and that's part of the legal challenges that are coming up, where you have people saying the government has never required us to buy anything before, which really is not true. When you think about it, we're required to buy state and federal taxes. When we pay our state and federal taxes and we have to go out, we're basically buying the services the government provides. We're buying the military. We're buying the Federal Aviation Agency. We're buying the Food and Drug Administration. If you're paying state taxes, you're buying the State Highway Patrol. So of course you're buying the things that government must provide for people. But generally, I think that this bill, it's not a perfect law, and I think we're going to discover that as we get into this process, some parts of it are going to work better than others. The parts that don't work as well as they should will probably be revisited.
Okay, so this law on the legal front, then our last subject here, the law can be changed as experience dictates.
That's right.
Yeah. Okay, can this law be done away with completely?
Well, there are a number of state attorneys general who are trying to do just that. Our listeners may recall that recently Governor Pawlenty asked Attorney General Swanson to file suit with those states that are challenging this law, basically seeking to have it turned down or ruled unconstitutional. I don't think that that's going to be a very productive path. Attorney General Swanson, after reviewing the law and reviewing case precedent, determined that the arguments on the side of nullification of the law are not very strong. Congress has a very broad power in the area of interstate commerce to tax, and a very broad power which has been established to support the federal income tax, Social Security, Medicare, Medicaid. These types of challenges are not new, and invariably the federal courts have sided with Congress having the power to legislate. And if people don't like what Congress legislates, they have the option every 2 years of voting for different representatives.
And as different parts of this bill kick in, in the coming years, it's going to be very unpopular to take away student coverage to age 26, to take away the lifetime limits, to take away the previous health conditions.
It's tougher to take things away from people once they've got it than to keep them from getting it.
So as people come to experience this law, they will find out how good it is, and that will take some time as we learn what is in the law, and as we indicated the different timelines. So Steve Francisco, Federal Policy Director for the Minnesota Council of Nonprofits, thanks for appearing today and for explaining so clearly some of the provisions of the 2010 Healthcare Reform Law. And there's a whole lot to like about this bill, and there's a whole lot to learn about it. But we know why it's considered such a major accomplishment for Congress and the President. But we all have to keep informed, keep on being informed on health care. So, Steve, are you up for coming back sometime?